Our study examined the log-transformed EMG amplitude power output relationship between the non-dominant and dominant limb. There are many different ways to look at muscular fatigue. However, in our study, we utilized EMG. The EMG amplitude reflects magnitude of muscle activity. It may be a combination of both muscle recruitment and firing rate. In physical therapy, EMGs can be used to obtain better information on neuromuscular diseases and muscle recruitment, appreciate how the human body's muscles function in response to therapeutic exercise, or potentially improve patient care and reduce medical costs. The purpose of our study is to use the log-transformed model to compare the difference between the dominant and non-dominant limb during exercise. The participants in our study included 9 healthy, college-age males who play soccer. Due to the nature of the exercises, individuals with previous knee injuries or cardiovascular conditions were excluded. An electrode was placed over the rectus femoris muscle on both the dominant and non-dominant legs. Dominance was determined by their kicking preference. The intervention consisted of a 2-minute warm-up. The power output was then increased by 6 watts every minute until the individual reached a Borg rating of 8 out of 10 or higher. Some subjects rated their Borg at a 10, but still maintained the predetermined cadence, so it was then terminated when they were unable to maintain cadence. We used a paired t-test for the dependent variables, where b was the slope and a was the gain factor, in order to determine if the EMG amplitude was statistically significant. Our subjects achieved a mean power output of 75 watts. For this exercise mode, we did not anticipate the subject to be over 85 to 90% of their age-predicted heart rate, because the exercise was purposefully designed to minimize the cardiovascular limitations. We found that the slope term, b, for each value was statistically significant because the 95% confidence interval did not include 0 in the range. As you can see here, the slopes between dominant and non-dominant limb are nearly identical. The paired t-test for the slope and y-intercept terms revealed no significant mean differences between each leg. The main findings of our study were that there were no significant mean differences between dominant and non-dominant leg. However, the slope value term for each subject did not reach 1. Thus, for both limbs, the slope term value was significant for that subject. It would be beneficial for future studies to determine statistical approaches that address the inherent large variability for the y-intercept derived from the log-transformed EMG amplitude power output relationship, and to account for the skin fold thickness over the rectus femoris muscle.